Therapeutics of antidiarrheal, antiprotozoal, and anthelmintic drugs. As we discussed in the lecture of the antiprotozoal, anthelmintics, and antidiarrheal drugs, the drugs which are used for the management of the diarrhea, anthelmintic infection, and antiamoebic drugs. So these drugs let us apply in the case. The first one is a 14-year-old child presents with severe vomiting and diarrhea. Severe vomiting and diarrhea, which is generally rice water and fishy odor. On examinations, he was drowsy and has dry tongue, sunken eyes, and loss of skin elasticity. The parents are anxious that should be given antibiotic to enhance ensure and enhance the recovery. The age of patient here is 14-year-old, and the main remark is severe vomiting and diarrhea. As the diarrhea, there is a loss of electrolytes and water from the body, and that's why the skin elasticity is lost, and the patient is drowsy as well. The first question is antibiotic therapy is appropriate to this case or justify? Now, in my opinion, it's an severe diarrhea and vomiting, so antibiotic therapy is appropriate. Yes, antibiotic therapy should be initiated on indication of severe, or we can say explosive diarrhea. What is severe and explosive diarrhea? In the severe and the explosive diarrhea, the frequency and the force of diarrhea is higher as compared to normal diarrhea. The frequency and the force of diarrhea is high as compared to normal diarrhea. So that's why here antibiotic therapy is recommended, because generally the severe and explosive diarrhea in the most cases is due to infection. In the most cases, it is due to infection, maybe bacterial infection, maybe viral infection, or maybe amoebic infection, maybe helminthic infection. So that's why, and in the most of the cases, as compared to bacterial, viral, and amoebic and helminthiasis, the most common is bacterial diarrhea with the causative agent of E. coli. So that's why antibiotic therapy should be recommended in the severe or explosive diarrhea, because severe explosive diarrhea indicates, or we can say remarks with the frequency of the loose stool or watery stool with the high force is an indication for the infection, and we have to treat the infection here. That's why antibiotic therapy is appropriate when the case is severe. How can you manage such a case? The first important things in the case of diarrhea, we have to rehydrate the patient. We have to maintain the water and electrolyte balance in the patients. So if the patient is conscious, the first thing should be taken by oral is oral rehydration salt, ORS, which contain the electrolytes. ORS are the electrolytes and contain the sodium chloride, potassium chloride, sodium bicarbonate. So these are the electrolytes generally lost in the diarrhea. So we have to maintain this electrolyte by taking in the form of oral rehydration salt, or if the patient is unconscious or severe, we can apply normal saline which contains sodium 0.9% sodium chloride, or as per the situation we can apply ringer lactate, that is RL. Second step of management is antibiotic, because the severe diarrhea is an indication for the antibiotic therapy. And generally the most commonly widely used antibiotics are azithromycin from the macrolide category, fluoroquinolones which contain ciprofloxacin, levofloxacin, ofloxacin, and rifaximin. Rifaximin, it is from the category of rifamycin derivative, and rifaximin is not absorbed orally, and that's why it only act on the intestine. And rifaximin inhibit the nucleic acid synthesis in the bacteria. Fluoroquinolones inhibits the DNA gyrase in the bacteria. So these three antibiotics are commonly used. And third one is loperamide, which is generally anti-motility agents, which inhibits the motility of the intestine and reduce the frequency of diarrhea. Second case, a 60-year-old woman was hospitalized 5 days ago for the treatment of diabetic foot infection. On the first day in the hospital, a broad spectrum antibiotic was initiated orally. The patient now complaining of water stools, nausea, vomiting, abdominal cramp relieved by the defecation. On physical examination, the patient has moderate dehydration and her temperature was 38.6 degrees Celsius. Other vital signs were normal. Now here consider the age of patient. The age is 60 year and she was taken the broad spectrum antibiotic, and after taking the antibiotic she was complained about the diarrhea, watery stool, and the temperature of the patient was 38.6, we can say fever. So how can you treat this case? Now first identify the case. After taking the broad spectrum antibiotic, she developed the symptoms. So this is the case of antibiotic associated diarrhea. We can say this is due to use of some antibiotics broad spectrum like clindamycin, fluoroquinolones, cephalosporins, and also amoxicillin. The patient complains the diarrhea, and this is the case of the antibiotic associated colitis due to use of the broad spectrum antibiotic. Because this broad spectrum antibiotic inhibits the good germ in the intestine, and then clostridium difficile microbe is easily infect the intestine causing diarrhea. So this is the infection of diarrhea is due to clostridium difficile. So first measure is stop the causative drug, that is a broad spectrum antibiotic which was taken by the patient. Second one is, yes, oral rehydration salt for the dehydration. We have to retain the rehydration, and if the patient is old age, or we can say unconscious, or we can say severe, we can use normal saline or ringer lactate to maintain the electrolyte balance. Paracetamol for the fever, because the temperature was 38.6. And now we have to give the drugs or antibiotic which kills the clostridium difficile, which is responsible for the diarrhea. And the antibiotic for clostridium difficile is metronidazole. We can say it is a drug of choice. And yes, because the good germs are inhibited by the broad spectrum antibiotic, we need to retain the good germ, which are generally the security guard of the intestine. And we need the probiotics in the form of lactobacillus acidophilus. You can give the probiotics. These are the management lines for the treatment of the diarrhea in this case. Third case, a 4-year-old child presents with a 4 days history of diarrhea. Now the patient, consider the patient is 4-year-old child, and the 4 days history of diarrhea, which has occasionally been bloody. The child is otherwise well and taking fluids. Examination is unremarkable. The parents are anxious that he should be given antibiotic to ensure and enhance the recovery. Is antibiotic therapy is appropriate to this case? Why? As we discussed, in this case, the diarrhea is with the blood. So, S, obviously, bloody diarrhea is an indication for antibiotic therapy. How can you manage such a case? UD management of diarrhea, we need oral rehydration salt to maintain the electrolyte balance in a in the patient body. So ORS is the first line treatment. Antibiotics for suspected organism. If the physician think that the cause of organism may be the specific, so he can prescribe specific antibiotic, or he can prescribe empiric antibiotic till the lab results arrived. So antibiotic for suspected organism is very important, because the bloody diarrhea is an also indication for the antibiotic therapy. So empiric therapy, in the empiric therapy, the generally the fluoroquinolones widely used in the children's, including ofloxacin, loperamide, antimotility agents, and the newer agent is racecadotril, which is generally acetorphan, is an oral encaphalinase inhibitor for use in the treatment of acute diarrhea. Racecadotril Racecadotril treatment also result in significant reductions in the stool output compared with placebo in infants and younger children aged 2 months to 4 years with acute diarrhea, in infants and the young age children 2 months to 4 years with acute diarrhea. So this drug generally, racecadotril, can be used in the children from 2 months to 4 year, and it was quite significant to reduce the stool output. So racecadotril may be initiated because the patient age is 4 year old. Next case, an 80 years old woman develops a profuse diarrhea 7 days after commencing therapy with amoxicillin for respiratory tract infection. The question is, what are the possible infective causes for this diarrhea? As we discussed, antibiotic, it is a case of antibiotic induced diarrhea, or we can say antibiotic associated diarrhea. Consider the age of patient, 80-year-old, and she develops the profuse diarrhea 7 days after commencing the therapy with the amoxicillin for respiratory tract infections. So this is a case of antibiotic associated diarrhea. When a person takes antibiotic, the good germs in the intestines are killed off, making it easier to become infected by the Clostridium difficile germ, which causes diarrhea. How can you ensure the diagnosis? Clostridium difficile is diagnosed by testing the stool of the patients. Flexible sigmoidoscopy may be performed to confirm the lower part of the intestine colon is inflamed, and these are the indications for the Clostridium difficile infection. How could this patient be managed? The first one is stop the causative drug or antibiotic which is responsible for the diarrhea. Antibiotic for the Clostridium difficile, metronidazole is a drug of choice to kill the Clostridium difficile. Now the good germs are inhibited by the this antibiotic, so we need to retain the good germ by using the probiotics like the lactobacillus acidophilus, and the most important is oral rehydration salt to maintain the electrolyte balance. Next case is a 75-year-old man presented with vomiting, abdominal pain, nausea, and non-bloody watery diarrhea with no fever. History taking revealed intake of dinner at a restaurant with some of his friends 2 nights ago. He has been informed from his friend that they had a similar illness. The patient has no significant medical history other than enlarged prostate because of his age. 75-year-old with enlarged prostate, diarrhea, vomiting, non-bloody, with no fever, and the histories the indicates the dinner at restaurant with his friend 2 nights ago, and his friends also had the similar illness. Physical examination was unremarkable except a significant decrease in the skin turgor and dry mucous membrane. This is due to the water and electrolyte loss due to diarrhea and vomiting. What is the most dangerous complication that can develop in this aged patient? The patient is 75-year old and the dehydration. The complications include severe dehydration, electrolyte imbalance, which leads to the shock, which leads to the hypotension and affect the cardiovascular function. What is the general approach to the management of this patient diarrhea illness? Obviously, ORS, oral rehydration salt, to retain the electrolyte and the electrolyte balance. And due to old age here, we need to give antibiotic therapy. An indication for the empiric antibiotic therapy due to old age, and generally ciprofloxacin 500 milligram 2 times daily by oral route is recommended. Ciprofloxacin is from the category of the fluoroquinolones and act by inhibiting the DNA guided nucleic acid synthesis in the bacteria. You can prescribe loperamide antimotility agent to reduce the frequency of diarrhea, to reduce the loss of water and electrolytes from the diarrhea. Patient also has the vomiting, so you can also prescribe the anti-emetic drugs including domperidone and ondansetron. Domperidone and ondansetron as an anti-emetic agent. Do you agree with the administration of diphenoxylate to this patient and why? As we discussed in the lecture, uh, the diphenoxylate, it is generally given with the subtherapeutic dose of atropine, and this atropine may responsible for the anticholinergic side effects. And this, in this case, the patient has enlarged prostate. So diphenoxylate administration should be avoided because it contains subtherapeutic dose of atropine which may causes the urinary retention, and it will trigger the enlarged prostate, and because the patient has medical history of enlarged prostate, so diphenoxylate should be avoided. Is a history of recent intake of antibiotic is relevant? No, because the patient friends also has similar illness after taking the dinner in the restaurant, so it may be due to the food or water contamination, and the case didn't describe the uh, patient has taken the antibiotic to relate with the antibiotic associated diarrhea. Next case, a 8 years old child present with 2-day history of diarrhea. The child is otherwise well and is taking fluids. Examination is unremarkable. How can you manage such a case? 8-year-old child, 2-day history of diarrhea. The examination is unremarkable, no fever, no blood, and no severity. So the oral rehydration salt is the first line with the loperamide, which is anti-motility agents. 1 week later, diarrhea is still present. How can you manage the case? If the 1 week later diarrhea is still, it is an indication maybe for the bacterial infections, because in the most of the cases diarrhea is due to the indigestion, maybe due to the diarrhea due to indigestion is revealed within a day or more within a 2 days, but it is not revealed, it is not able to control within a 2 days after the treatment of the loperamide, and still there is a diarrhea, and 1 week duration still diarrhea, it is one of the indications for the infection. So stool analysis for suspected organism is must, and s- still the till the stool analysis result, you can prescribe empiric antibiotic from the ciprofloxacin category, because in the children the widely commonly used antibiotics from the ciprofloxacin category including ofloxacin, others are ciprofloxacin and the leofloxacin. In the previous case, how can you manage diarrhea if stool analysis reveal the presence of either Giardia lamblia? Giardia lamblia is an parasite which is responsible for the giardiasis, the condition we can say giardiasis. And the drug of choice for the giardiasis is metronidazole, or another drug is albendazole. If this stool analysis reveal the int amoeba histolytica, that is amoebiasis, amoebic diarrhea, int amoeba histolytica cyst, the drug is, you can give metronidazole. And if the int amoeba histolytica tropocytes, you can give metronidazole or tinidazole or ornidazole. These are the three categories of the drug: metronidazole, tinidazole, and ornidazole. These are the three categories of drug from the 5-nitroimidazole derivatives, and these act by inhibiting the nucleic acid synthesis in the microbes. How can you manage a similar infected pregnant mother if there is a pregnant woman and infected with int amoeba histolytica cyst or tropocytes? You can prescribe metronidazole, and alternate drug is paramomycin, which is having the pregnancy category C. So pregnancy category C means we have to use with cautious, considering the risk versus benefit ratio. Metronidazole in the long term is also used with the cautious, because the pregnancy category C. If this pregnant woman has the same infection and the stool analysis is revealed the Giardia lamblia, so it is a case of the giardiasis. So paramomycin is the first choice of drug, because it is a category C, pregnancy category C, used with the cautious. And the another drug may be the metronidazole. You can prescribe the metronidazole according to the severity of the infection. Paramomycin, it is from the category of aminoglycoside antibiotic, which inhibits generally the protein synthesis. And this paramomycin is very poorly, it is not absorbed by the GIT, and that's why we need local effect at the intestine. So paramomycin is used from the aminoglycoside antibiotic category. And another measures are very important. Don't forget to add oral rehydration salt in the case of diarrhea. and plus you can give the loperamide antimotility drugs. Next case, a 35-year-old patient present with a 5 days history of bloody diarrhea. The patient is otherwise well and is taking the fluids. Examination is unremarkable. Stool analysis revealed the presence of int amoeba histolytica tropocytes. If there is a stool analysis indicates the int amoeba histolytica tropocytes, the first line drugs are the metronidazole and tinidazole. Metronidazole and tinidazole. Other drugs are also you can give, including albendazole, paramomycin, iodoclonol, chloroquine. But the first line drug is metronidazole, tinidazole, ornidazole, and another drugs you can also give, uh, including the paramomycin. How can you treat the adult patients if their stool analysis reveal the following? If the stool analysis contain Ascaris lumbricoids, which is generally the nematode, and for the nematode infection, the drug of choice is albendazole. If the stool analysis reveal Tania saginata, which is generally the tapeworm infection, and for the tapeworm infection, the best drug is praziquantel. And if the stool analysis reveal the cystosoma mansoni, which is termed as trematodes, the drug of choice or commonly used drug is praziquantel. So praziquantel you can give in the treatment of the tapeworm and trematodes. And if there is a nematodes, you can prescribe albendazole, which are generally commonly used drug in the treatment of such cases. About the albendazole, praziquantel, we already discussed in the lecture, so you can go for further reading. References for the further reading. I request all of you, please read more, read more, read more from the books and online resources to build your knowledge. Thank you very much. Assalamu alaikum.